How many of you as pain patients have been accused of drug-seeking behavior at some point by a medical professional? Like this comment from Jessica talking about how her self-advocating winds up getting her labeled a drug seeker. That proverbial medical hand grenade, by the way, that these professionals throw at us so often, and all the problems that it caused her. Why does this happen? Why do doctors label self-advocating, especially from us chronic pain patients, as drug-seeking behavior so often? Well, if you said the DEA, then ding, 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 you're right on point. The DEA created literature like this specifically for doctors called How to Spot the Addict or How to Spot Drug-Seeking Behavior. Seriously, it's ridiculous, right? Now let's throw up the actual things that they tell doctors to look for right at the top. Unusual behavior in a waiting room. I have no idea what that even means. An assertive personality. If you stick up for yourself too much, you're obviously a drug addict. Number 2, unusual appearances. If you dress too well, you're obviously a drug addict. But if you aren't dressed well enough, you're also obviously a drug addict. See how that works? Then number 3, may show unusual knowledge of controlled substances, i.e. medications. We might know a little bit about the medications that help us maintain our quality of life and that many of us have been using for years. Shocking, but that obviously makes you a drug addict. And then last, states that specific non-narcotic pain medications do not work for them or that they are allergic to them. They don't work for really anybody. They're no better than placebos for the most part, talking about like Tylenol and NSAIDs. And then if you're allergic to those things, you're obviously a drug addict. You see how this works, guys? You see how asinine this is? John and I created the CPWU just to get rid of stuff like this as well. It's absolutely ridiculous.